For childcare practitioners, health and safety is a major part of the services we provide, and improving the standards of hygiene and safety is crucial. That's why we decided to implement the SEC program.
SEC program is so important, especially when dealing with early years education, because it follows international guidelines and guarantee that safety is in place.
Implementing this SEC program has been great for our reputation, because it's something that parents can see is not required by the government, and it's something that we've gone above and beyond to make sure that the hygiene and the safety is really good in our nursery.
Documentation is a major part of our job, as it keeps marks and proofs of the policies we implement at the nursery. And it helped us not only being compliant with the requirements of health authorities, but also to take hygiene and safety to the next level.
Since implementing the infection control, I've definitely seen a decline in the rate of absentees as opposed to other years where we didn't have this policy in place.
The Boyka program has helped us to decrease any risks happening in the nursery by putting policies in place, different procedures in place, which will help us for the future.
The documentation part of the program was really important because that helps us to be more organised, more efficient, to know where all our files are located, should we need them, and makes it much more easy for me as part of management to cascade that down to my staff.
We like at the nursery to work in partnership with parents and to have them engaged in every plan of improvement we implement at the nursery, and the program really allowed us to work together towards providing a safer environment and a healthier environment for their children. It was also a learning opportunity for them in terms of knowledge related to health and safety, and of course the program helped building trust between us and the parents that they have made the right choice.
The program was implemented as a real opportunity for us to raise standards in the Redwood nurseries, and really as a validation of the good work that all of our practitioners have been doing to date, inclusive of the nursery management, and having that certified.
After implementing the infection control measures, we have noticed that absenteeism at the nursery has decreased. Especially when it comes to infections that are transmitted through direct contact with contaminated surfaces or objects or other people. So we are very satisfied with the outcome.
The audit itself was very rigorous on all fronts of looking at child safety, from pest control to food handling to safe sleeping of children. It really made us examine all aspects of our practice.
I believe, and I've seen a big difference since the training has been done, the staff are more confident. They will address issues and bring me ideas on how to fix things. It's also really good, they're more aware of things like checking children's food temperatures, making sure that there's no risks that lie before the children, and that just keeps the children safe inside the nursery.
When we had the training for our staff, it's really give them more knowledge how to deal with children, give them more responsibility that practices need to be in place, especially for hygiene and safety and their way of dealing with children.
It highlighted those areas. It made all of us, the whole of the staff, have a lot more understanding about the needs and requirements of health and safety, and how the program helped us to implement all those things.
For all of the Redwood nurseries to have gone through the certification program has been of great benefit to each individual nursery and Redwood nurseries as a whole.